Hello everyone, welcome to Physioversity by Boronogur Physiomax. Today we are going to discuss about exhalation process and the function of abdominal muscle. Exhalation is a passive process. It is considered as passive as it requires minimal energy expenditure. During exhalation, the air pressure within the lung equalizes with the atmospheric pressure, which helps the air to blow out from the lung. At that time, the diaphragm and the intercostal muscle, that are the primary muscles of breathing, also relaxes. Okay, and diaphragm come into their normal level. That is in case of, as we know that in relaxation time, or in case of relaxation, the diaphragm come into or at the level of fifth intercostal space. Okay, and the rib cage also, or the ribs are also come into their pre-inspiratory phase. Now, rising of the diaphragm will create an pressure, okay, in pressure, or it will create rise in the intrathoracic pressure above the atmospheric pressure, which help the air to blow out from the lung, that is exhalation. That is why the exhalation is also known as a passive process. Now we will discuss about some abdominal muscles. First one is the rectus abdominis, which arises from the pubic crest and inserted into the xiphoid process and the costal margin of 5th, 6th and 7th costal cartilage. They are also innervated by spinal nerves, and their action is considered in context with the other abdominal muscle. The second one is the external oblique abdominis, which arise as an oblique line from the 5th costal cartilage to the 12th rib. It is innervated by lower 6th thoracic spinal nerve. The third one is the internal oblique abdominis, which originates from the lumbar fascia, the anterior 2/3 of the iliac crest and the lateral 2/3 of inguinal ligament. Its posterior fiber run from almost vertically upward to insert into the lower border of last 3 ribs. It is innervated by lower 6 thoracic nerves and the first lumbar spinal nerves. Another one is the transverse abdominis, arises from inner surface of the lower 6 costal cartilage, the lumbar fascia, the anterior 2/3 of the iliac crest and the lateral 1/3 of the inguinal ligament. It runs across the abdomen horizontally to insert into the aponeurosis, extending to the linea alba. It is innervated by lower 6 thoracic nerves and the first lumbar spinal nerves. These 4 muscles together work as a firm but stable wall to keep the abdominal organ in position, while the pelvis and the thoracic area remain fixed. The abdominal muscle create an compressive force to the visceral organ that helps us for urination, perturbation, defecation, vomiting, etc. The abdominal muscle also help in coughing. First, the large volume of air is taken, the glottis is closed, and then the abdominal muscle will contract. This contraction will cause the rising intrathoracic pressure. When the glottis will open, the differences of air pressure in the intrathoracic area and the atmosphere will cause the air to exhale forcefully from the lung, and that causes coughing. Thanks for watching. For more such content, don't forget to subscribe our channel.